Well, thank you very much for Gateway for inviting me today. I'm Sarah Milner, and I'm the Executive Director of the Central Lambton Family Health Team. So we're a rural health team located in Sarnia-Lambton, and we have 12 doctors, a number of allied health practitioners, and we have about 19,000 patients. So we're fairly large for a rural health team. I just wanted to build a little bit more on Dr. Patel's very important information that she touched on around herbal supplements, things of that nature. There's a lot of advertising on TV, social media, magazines, and I myself have, talked to friends, neighbors who have recommended things that worked well for them. And I just wanted to kind of add to that, often people, as Dr. Patel said, don't always consider these as medications. But we need to think of them when we're thinking about our primary care, like medications, just because of the effects of them, and also for being able to have a complete picture of all of the things that you're taking and how that might interact in terms of the medications together, but also with your health conditions. So a lot of people think because they're natural, they won't hurt you or they won't have a negative impact. And although some people don't have a negative impact, there are times when it does happen. And everyone's situation is different. And, there are a lot of people, especially as people age, tend to, as Dr. Patel said, have a higher number of medications they're prescribed. And again, it can be really important for your primary care team to know this information. She had mentioned St. John's wort, and that was very popular. I can recall I worked in mental health years ago as a nurse, and it can make, other medications less effective when taken together. Ginkgo can increase that bleeding risk when combined with the blood thinners like warfarin. We have a lot of patients in our practice that have AFib or mechanical heart valves, and they're taking a blood thinner such as warfarin and don't always recognize or realize that could have that interaction. Ginseng is another one that was very popular, and it can affect blood glucose levels, leading to reduced blood sugars, and lowering the effect of some medications. And also another interaction with warfarin. Milk thistle may decrease the concentration of certain medications metabolized by the liver, and again, with the warfarin. So the takeaway is that the herbal supplements must be kind of considered whenever you're giving a list of medications, you need to include those. And I would recommend that, checking with your pharmacist. As Kristen talked about, that is an important relationship. So, if you've seen something and you're interested in trying it, that pharmacist or pharmacy staff are very good to be able to help to give you some of that information. Also, if it's your pharmacy, they can check against some of the medications you're already taking to know if there's an interaction or if it might be safer not to take that. So that is such an important resource. And you should let why it's important to let your physician or your primary care team know at the office is so that, if there is a condition that's being treated, it could have an impact on that. Even if you are in to see the respiratory therapist, it could be important to let them know. Any of the interdisciplinary care team, your primary care team, can update your chart and their notes would go in your actual chart. So that is a great place for your provider to be able to get that information, or they can send a message to your provider just so that they're updated or can update your list in your chart. Particularly if receiving blood thinners, like warfarin, we do in our primary care office a lot of work around people having to have blood work, and it's INR blood work. So we get those results, we call patients, we follow up, and we're giving, based on the range, what their level has come back on, we're giving advice and direction around changing those doses. And if we don't know that you're on a supplement that could be affecting that blood thinner, that makes it very difficult. We might increase that dose unnecessarily, and that could also lead to issues with bleeding. So again, just important to keep your team in the know, and that way we can keep things safe for you. And another impact that the healthcare team can have is that, again, if some of these supplements are affecting your blood sugar and you have a diagnosis of, say, diabetes, that could also be something very important to know, or it could be unintentionally that you're increasing your levels and don't even realize it with some of these supplements. So again, very important to write down, or at the pharmacy, they can give you a printout of your current medication list. You can just write on the bottom any supplements that you might be taking. Really helpful to keep in your wallet or your purse. Again, sometimes that's not always possible, but if you happen to be ending up going to emerge, which hopefully isn't the case, but you can pull that out and share the list that you're on, of a complete list of either over-the-counter supplements, prescribed medications, and also if you're going to your primary care office, you can share that list with them too. And it's important to check in. Like I said, an opportunity might not be that you're seeing the doctor, but maybe you're seeing the nurse practitioner, you're seeing another allied health professional. You can give that list. They'll update your chart. That helps us to keep up to date on what your health or your whole health picture looks like. And another piece too is that it can be really easy to go online and order things and have them shipped to you. So again, just always really important before you do that is to check with someone who knows that information, just because it could have that detrimental effect that you wouldn't be intending. And sometimes we have a lot of patients that are trying to stay at home and, want to manage their care, and they are still maybe on the family farm. They're trying to manage, maybe they're older adults, they're wanting to manage things living in rural areas. And, they're putting in place some home and community care and different resources and things, and to promote the capacity of people to kind of stay in place and be able to live in their homes and where they want to live. We have a lot of patients that are in their 80s and 90s, and they live way out in the country. So it's important to have conversations about your medications. Sometimes things happen and people that are close to you don't always know where to find them, what you're on, what you're taking. If there's an emergency. In our area, in our county, we have a program with our EMS called Kool-Aid program. And it's like a almost the size of a postcard or a little bit bigger, that's magnetized, that people can put on their fridge and put their most up-to-date list of medications or important contact information for if there is an emergency and paramedics come, who to contact, and some key information. It might be an idea to have somewhere handy that someone could find it. We also, are utilizing different tools and aids, like Dr. Patel said, around if you're having a difficult time managing your medication, because there are many of them, or you take them at different times. I know myself, if I've taken an antibiotic, I sometimes an hour later, I'm thinking, did I take that when I take it out of the bottle? Or sometimes, with sight, the writing on some of those bottles is pretty tiny. So, but that can also be altered at the pharmacy for the print size if needed. But it's, utilizing things like dosette boxes, which you can organize your medication into, the blister packs. There's those dispensing machines, things that can make it easier to remain independent and make sure that you're getting the doses that you need when you need them. And sometimes it can happen. Sometimes you could forget you took a dose, or you could think you didn't take it and take an extra dose. So sometimes putting some systems in place can go a long way. And believe me, we all need them sometimes. It's not just due to age. So another important element is being careful. Sometimes if you're living alone, especially if you're in an isolated area, about sharing sometimes in public some of the medications you're on. For instance, sometimes narcotics or opioids, things like that. Those aren't information you want to be, sharing out there, because sometimes that can put risk in terms of people knowing that you have them in your home and potentially wanting to take them. So that's just another piece to think about. And you may want to talk with your healthcare team about, if there's certain medications and you're not sure, bringing someone with you. If you have questions or you want them to hear the information and they can write that down or remind you later of the conversation, you can go over that. Or if there's someone that you want to give consent for your primary healthcare team to talk to, that can take the information or can make a call and ask a question on your behalf. A lot of times when we're doing the INRs for the blood thinner monitoring, sometimes there are certain patients that it can get quite confusing with changes, and they have a designated person they've given consent to contact with that information that may then in turn work with them to help them to make those changes. So, there's lots and lots of options of how we can help you. And we really work hard as a team to share information. So if you're in seeing maybe one of the nurses for a vaccine and mention a concern or something about your medications, that nurse can go down the hallway and talk to your doctor or put a note in your chart. And so we really work together, even if it's a referral to maybe a team pharmacist, to kind of provide that more holistic care and wrap around in terms of your needs. Sometimes too, even with diagnosis and, medications and different life changes, part of being part of an interdisciplinary team may mean that you have extra resources such as social work or ways of connecting with other allied health professionals. We have the icy weather and things coming up. And, you may want to tap into things that can make your medications easier to be able to get. Things like pharmacies can deliver at times, depending on their range. Sometimes that helps too, to be able to be more compliant with medications. And just making sure too that you take a look at your refills and someone show you, if you're not sure, where to find that, so that you can contact the primary care office or your provider in advance so that you don't run out. It can take a few days sometimes for that coordination for things to be filled. So those are some of the things about working with an interdisciplinary team. And it just allows us to be able to coordinate that care. And we do work very closely with our pharmacy partners to be able to, coordinate that care. And the bottom line is that, we're here to help. And it's important as we go into the holidays to be really aware of the hours of your primary care team and where to get help if they're closed. So familiarizing yourself in your area with all the resources of urgent care clinics, access to care clinics, all of those different places. There's even virtual care clinics now. But hopefully if it's not an emergency, you don't have to go to emergency rooms, but good to be familiar with the hours that your doctor or nurse practitioner's offices are open over the holidays, just so that you don't run out of medications or find yourself in a situation where you're short. And that's about it for me in terms of the interdisciplinary piece.